This is our level 1 rapid infuser and fluid warmer. It is an essential tool in the life-saving process of hypovolemic shock patients or surgical patients. We use it also for hypothermic patients as well because it warms the fluids as it's going through the system. Contraindications with the rapid infuser are warming platelets, cryoprecipitants, and granulocyte suspension. So basically the only thing that we are going to hang in the rapid infuser is packed red blood cells and fluids. It's pretty simple to use once you are aware of how to use it. If you do get lost, we do have instructions on how to use it if you are pressed for time. On the rapid infuser, it is numbered. We have number 1, 2, and 3, and you literally just go by numbers on this. First of all, you want to explain the procedure to the patient with what you are doing and why we are performing the procedure. Next, you want to make sure you plug the rapid infuser in. You will get your bag of fluids or your blood product. You will also need the level 1 tubing extension, which are kept in our closet here, and an extension tubing because the tubing is a little short. So you turn the infuser on. Before you do any of the fluids, you do want to make sure that the fluid level is in the correct alignment. It will tell you the minimum amount and the maximum amount. If it is below the minimum amount, you can fill it up with a bottle of water. Next, you will open your tubing setup. And you are going to clamp all your clamps off. Also, if you do hear the beeping in the background, it is just alarming, letting you know that it is not set up and ready to go. Once you have the patient hooked up and you believe you are infusing your stuff and you hear the beeping, that means that something is wrong and you need to go step by step to see what is going on and what was missed. Once your clamps are shut, you are going to open your fluids and open one of your spikes. You are going to spike your fluids. Once you penetrate it, you are going to remove your spike, and using aseptic technique, you are going to burp your bag of fluids so there is no air in the bag. This is a very important step because this infuses so rapidly that if you do not catch that there is air in the line, you can possibly cause an air embolism with the patient. Once you have it spiked and ready to go, you will open the door and hang your fluids on the little hook that's on the door. Once you have it hooked up and hung, you will prime this little chamber first. And then you will just, obviously you want to make sure your tube's all connected. You will follow the numbered instructions. So you want to start by putting the bottom of this white plastic tube into the number 1. You will push down, and then once it's in, you are going to pop this up into this little holder right here, and you will hear a click. Once you hear that click, you are going to press this down. If you press this down and this white tube is bent forward, it is not in place, and you will need to open this back up and place it properly. Once this is in place, you will move on to number 3, and you snap this in. I am still locked on all my clamps at this time. If we are just using this for a fluid warmer, your temperature is printed right here in the temperature display, and you do not have to close that. Once this is all done, you are going to prime your tubing. Most likely you want to stand over a trash can because this will go fast. So you open all your clamps. And you're going to make sure all the air bubbles are out. And to prevent air embolism, you are also going to tap the air bubbles out of the filter down here. If you do need extension tubing on, you would put it on prior to priming the tubing. If we are going to use this as a rapid infuser, you will go ahead and put your fluids in there and shut this door. Then you will move this little metal tab over to the plus. That means it is pressurized, and this is when it is going to go in within 3 to 5 minutes. This infuser, you do need to have one person manning it at all times. So you will moved it to the plus sign, you open all your clamps, and it literally just pours out. While doing this procedure, if you are going to use the rapid infuser or the fluid warmer, you want to make sure you have 18 gauges or larger bore IVs in place. You can have 2 liters of fluid at the same time, or your blood products and your fluid. You do need to make sure you watch the bags closely because you do not want any air getting into the tubing. Keep in mind, just like anytime you infuse blood products, you want to make sure your wide tubing, if you are priming your blood, that your fluids are locked off so it does not infuse into the other product. And of course, normal saline is the fluid of choice for blood products. Keep in mind, if you are giving fluids related to blood loss after 2 liters of crystalloid fluid, you need to stop, ask the provider if they want to consider infusing blood products instead of fluids. We do have a massive blood transfusion protocol in place that you will just have to call lab to activate at that time. If the physician does want it, the physician will have to order it first. Secondly, again, we only want 1 nurse to run the rapid infuser. And then third, we want to make sure that everything is documented in the EMR. Just like any other blood product, you would document under blood product infusion, or fluids, you would document under your MAR.